I'm a little nervous.
There you go. You got it.
Good morning. My name is Dána Langford, and I want to thank you for being here today. It means the world to me, with you, to celebrate this powerful moment in Glenville. Although I was born in West Africa, Liberia, and came to the United States as a young child, Cleveland has become my home. It's where I've healed, I've grown, and I've become a mother, and hopefully one day a wife. And it's where I first had the strength and resilience that lives in the neighborhood. My father is a longtime teacher at Glenville High School and has served the Cleveland Metropolitan School District for many years. Through him, I've come to understand what it means to pour into a community, to show up every day, and to shape a community in the next generation. What this mural represents to me is more than art. It's a symbol of beauty, pride, and survival. It reminds us that Glenville is rich with history, with culture, and with people who rise again and again and again.
Yes.
Even in the face of hardship. As a survivor, it's deeply meaningful to me to see this mural placed on the side of Cleveland Rape Crisis Drive-In Center, a place that holds so much care, safety, and hope for people like me, a place that helped me remember that my story mattered, an advocate that fought for me to remember that our story mattered. So today I'm honored to share space with all of you, and honored to add my voice to this collective moment of healing, celebration, and forward movement. Thank you for showing up, for me, for survivors, for Glenville, and for one another. Dána.
Good afternoon, everyone. And thank you for being here. It truly means a great deal to gather in this way, to pause, to breathe together, and to reflect on the work that we share. What we just witnessed in that video is a powerful reminder of why this work matters. The mural at our anti-human trafficking drop-in center in Glenville is more than just public art. It's visibility. It's affirmation. It's a declaration that survivors belong in community spaces, not in the shadows. That project came together through collaboration between CRCC, Destination Cleveland, Third Space Action Lab, and local artists. Let's give them a hand. And all of our community members. This is an example of how unlikely partners can become meaningful. Meaningful partners that share in a commitment to dignity and healing. And at the center of that moment is Dána J. Dána J, we thank you. Thank you for your courage in reading your letter to the community. Thank you for trusting us with your voice. And thank you for reminding us that what it means when survivors are not only served, but they're seen. We are honored to have her in our CRCC family today. That mural faces a busy street right here on the other side of the bridge in the Glenville area. Every day people drive by it. They walk by it. They live alongside it. And what they see is not just paint on the wall. It's a message. A message that healing is possible. A message that our communities, they matter. And a message that our survivors are not alone. So let me say this clearly. On a space that honors our city chose a place to place a mural for survivors in Glenville not for decoration, but declaration. It says that this community refuses to look back, and cities that refuse to look away are cities that change outcomes. So, before we talk about impact, numbers, or what's ahead, I want to begin with gratitude to our staff, all around the room, all upstairs that are busy servicing our survivors. I say thank you. Can we give them a round of applause? Thank you to our staff who brings their authentic self to work each and every day. Thank you for the care that you bring. Thank you for your professionalism, your empathy, your creativity, and your resilience. Thank you for holding space for survivors in moments that are often overwhelming, painful, and deeply personal. But most importantly, thank you for showing up, even when the work is heavy, even when the system feels fragile, and the path forward requires adaptability. I think we all know about that right now. So I know we gave a hand clap, but I want to make sure that they stand up and be recognized. So any staff that are here right now, if you could please stand, wave your hand, so that everyone can acknowledge all of you. Now, as we continue our State of CRCC, I want to shift us from the reflection to vision. It's Women's History Month. It's Women's History Month. And this afternoon, I'm going to lend your ears to two additional extraordinary women. We are one of the few organizations in this region that are led by women across the executive and board leadership. That is and in a world that sometimes says that we can't, and we do, it matters. Representation in leadership matters. Lived experiences in leadership matters. Vision in leadership matters. And I have the privilege of serving along two remarkable leaders, Lisa and Dána. Lisa Radigan has served on the CRCC board for 9 years. Yes. She has helped steward this organization through evolution, growth, transformation, and a lot of other things. This year, as she prepares to conclude her term as our board chair, we recognize both the legacy and the leadership that you leave behind. And Dána Langford, co-founder and president and CEO of the Village of Healing. They both bring visionary lens around culturally responsive care and community rooted in leadership, and what equity must look like in the next generation. So we're going to have a brief conversation and invite you in about leadership, about evolution, and most importantly, about the next 50 years of CRCC. So let our fireside chat begin. Tell us a little bit more about yourself, who you are, and what you do, and how you became connected to CRCC.
Sure. Well, first of all, thank you for that wonderful introduction. And I would be very remiss if I didn't also thank you, Nicole. You thanked the staff, you thanked the board, you thanked Dána and I, but you are what is leading and driving this organization every day. CRCC, so it has been a number of years now. In my day job, I am a lawyer. I started my career at a law firm, a wonderful firm called Jones Day, and I'm now in-house at a company called Diebold Nixdorf, where I have the privilege of leading staff around the world, and I come back to my style of leadership is about service. And how do we be of service to each other? And so when I was looking at organizations that I thought I might want to give more of my time to, and to feel connected to, CRCC was right there. The commitment to survivors, the commitment to the mission, the respect that this organization has in our community of Northeast Ohio, and the services that are delivered each and every day are critical and have only continued to grow. So I am incredibly honored and privileged and blessed to be a part of this organization. And I'm excited for the next 50 years. I may be terming off the board. You got me for another year, but I may be terming off the board, but I will remain a steadfast advocate for CRCC always. The work that everyone in this room does to support survivors and to, as Nicole always says, have uncomfortable conversations in comfortable rooms is incredible. So a huge thank you to all of you, to the staff, to everyone here who are supportive of that, and Nicole especially to you.
Thank you. Thank you.
So first and foremost, I echo Lisa's sentiment as far as Nicole is concerned. When I started on the board, it was under different leadership. However, I've grown, been raised, lived most of my life in Cleveland, Ohio, and the work that Nicole has done to put CRC in everybody's mouth. You cannot go on social media or anywhere else without hearing about the amazing work that she is doing, her staff is doing, and CRCC as a whole is doing. So first and foremost, I have to recognize that because you are amazing at what you do. Your entire staff is amazing at what they do. I'm not sure that people recognize what it's like to come into a trauma-informed space every single day and have to serve. And so again, I'm going to applaud all of you for the work that you do every day in that. So first and foremost, to my heart and core, I am a certified nurse midwife. I've practiced as a certified nurse midwife for about 17 years now. And every time I say that, I'm like, hey, I'm dating myself as I'm approaching age. But so, you know, I am a firm believer that God orders your steps. And so as a certified nurse midwife that has practiced in Cleveland and Georgia and Florida, I've had the privilege and the honor to work with survivors on a daily basis. And I've recognized that sometimes I am the very first person that a survivor has told their story to. And so I have carried that with me, and I have made sure to always honor those individuals. And actually, when I moved home, and I am also have the pleasure of serving as the CEO and founder at Village of Healing and the Village of Healing Center. And our board chair at the time had said, you gotta start getting on boards. And I'm like, wait, hold up, just take a step back. And so she introduced me to Lisa at the time, And I did my very first interview with Lisa, but I knew it was an automatic, this was the bridge, this was the order set by God. And then I had the privilege of meeting Nicole on the board, and Nicole really pushed me out of my comfort zone and got me involved in multiple committees, and again, ordered the steps where I ended up on the committee that chose Nicole to be the new CEO and president of Cleveland Rape Crisis Center. This organization is near and dear to me as now the vice chair, but as a board member, but as a certified nurse midwife in the community, because unfortunately healthcare is still dollars. And so I'm not able to spend the time that I should be able to spend with survivors, but to know that I am turning them over to an organization that is trauma informed, that is very culturally responsive, because the whole purpose of Village of Healing is to be culturally responsive. And to know there is an organization in this city that I can turn survivors over to and know they will be well taken care of. And then I have now the honor of serving on the board is just truly a privilege that I can never put into words.
Okay, this question is for Lisa. So you served on the CRCC board for 9 years. From your vantage point, how has this organization evolved and what has remained consistent?
So when I look back at 9 years of service, there has been significant change at the organization. There's been leadership change. We have an incredible leader in Nicole who brings that culturally aware, culturally sensitive treatment and support to people. And it's been just such a thrill to watch. And we've seen the results, right? We've seen how the changes in care being delivered to survivors is more impactful. We've seen how the changes in how we approach the work has changed to be more trauma informed. We've seen the changes in the staff and how the staff are supported and cared for very deeply as an organization. But what hasn't changed and what has remained for the last 50 years, not just the last 9, is the commitment to the mission and the commitment to survivors. There are thousands of people who utilize CRCC services every year, and what has remained steadfast is the 24/7 availability for people. They know that if they call or text or go online, they will find someone who will listen and who will believe them. And I know Nicole and the staff support that and work to advance that every single day. So that work hasn't changed, unfortunately. But it has only expanded, and what we see now, and I know Nicole, I'm sure will talk more about this, is that the complexity of those needs has changed significantly. The ways in which people need services, not just the one-off call, the hotline, but the wraparound services that come from that survivors of sexual assault need every day. We've opened a drop-in center. You saw the beautiful mural, which if you haven't driven by it, please go do, because it is truly an inspiring thing to see. And that drop-in center is designed and there for people who are victims of human trafficking. It gives them a place to take a shower. It gives them a place to get something to eat or find clothing. We've got a great partnership, and this is Nicole and the staff's leadership, to develop a medical suite there. So it's an incredible place, and one that took vision and dedication to survivors of all types, of all kinds, of all walks of life, who need it. So the needs have gotten more complex, but the mission remains the same.
Thank you, Lisa. So Dána, as national conversations about sexual violence resurface, what does that mean for organizations that are working right here in our local levels?
So, I actually just from my therapist really learned the word trigger. social media will have you saying a lot, and I'm like, oh no, that's what it really means. When you're actually triggered and you kind of don't know what is happening, what you're feeling, what is actually going on. And so I think, what we're seeing is, while we're all looking at these national stories, waiting for the fallout, waiting for accountability, waiting for things like that in the administration and so forth, what we have to recognize is this is truly the definition of triggering for individuals that are survivors in this community. And so while we're watching the news, we have to recognize that organizations like Cleveland Rape Crisis Center, other healthcare organizations, we're experiencing the triggered individuals who are coming in for services and help. And so while everybody's waiting for this to float up under the rug, the other organizations that are doing the work, that are on the boots on the ground, actually working with survivors, are now dealing with essentially the fallout of all of this. And as we're waiting for the news cycle to keep going and to turn over to the next, which we've even seen within this last week, unfortunately, our survivors aren't going to wait and turn over the next week. And so we have to be prepared that when those things happen, that we're actually doing the work, that we're here for them, that we hear them, and that we're able to service them in a different kind of way.
Thank you. So Lisa, prevention is often harder to fund and more hard to see. Why must it remain central in our strategy as an organization supporting survivors? Why do we need to keep that in the forefront moving forward?
So that's two good questions, funding and prevention, right? I would not be doing my job as board chair if we did not talk about funding and the true funding crisis that CRCC and other social services organizations have right now, right? The funding pipelines from a government perspective are drying up. And so the reliance on individual grants, on foundations, is only increasing. And that is certainly the case when we talk about prevention. The mission of the CRCC is to end sexual violence. You don't end it if you don't have prevention and you don't support prevention, right? How can we get on campuses? How can we get on in the schools? How can we talk about things like consent at a younger age so that kids grow up expecting it and that they grow up having the language to be able to say no and to respect no, right? So that funding is critical, but funding overall is crucial to the mission. It's something that we talk about every day. It impacts the work that we can do every day. And the need is only continuing to grow while the funding sources shrink. And so we need to find ways, creative as they can be, to be able to continue to fund that important work that goes on.
So Dána, moving forward and onward and upward, as we talk about the next 50 years of CRCC, what must we protect at all costs?
First and foremost, the survivors. That should be at the top of our list as we talk about the mission, as we talk about, like Lisa said, we've been around 50 years, but one thing hasn't changed. And first and foremost are the survivors. I think, in my own organization over the last 6 months or so, my language has changed, and there's a difference between being mission-driven and being people-driven. And so a lot of people come to nonprofits to work to serve the people and feel like, oh yes, I love this mission, I'm all about this mission, let's go. And then they learn that it's a nonprofit, and then they learn there's times when the funding goes down. They learn what that feels like, and then they're like, yep, on to the next mission. And so I think that, one of the biggest things that we see, and and the change that I've seen just in my tenure on the board is that first and foremost, this organization has moved towards mission driven. From the staff daily, from the emails, from the conversations, from even my own referrals for patients into CRCC, and I've been through a lot. I don't go through the normal survivor line. I send an email and it gets handled, and I know that I'm putting people in the right hands. And so being mission driven, I think the biggest protector is the survivors, but then like I said, you have no idea what it's like to walk into this environment every single day working with the survivors. And so next for me, the biggest protection that we need to do with CRC is the staff and the leadership here at the organization, because you can't pour out of an empty cup. And we say that all the time, but we really don't know what it means to have that empty cup and then still be forced to pour. And so I think that we have to protect the mission through funding, through working with the organization, continuing to lift the organization up. So first and foremost, the survivors. Secondly, the staff and leadership at the organization.
So when I served on the board, along with both of you, one of the things that drove my willingness and wanting to learn about how this organization was ran was talking to the staff, going to the events, having one-on-one conversations. Because as a board member, I don't just put on a t-shirt and put my name on a website. When I say yes, I'm 1,000% in, and the both of you are as well. And building those internal relationships and having those conversations lended to why I said yes to get on the other side of the table. Because it's more than just the work, it's relationship. And you cannot ask people to get up every single day, put on their clothes, drop their children off or four-legged friends, and come in here and not feel that they matter. And one of the commitments was, yes, the first 50 years was evergreen, and this is who we are. The next 50 years should be about empowering the people who help the people. And so that gives me hope as a leader to have board members who get it, who invest not only their time, but their treasure and their talent, because the work, it matters. And it gives me hope to come in every single day in spite of and in lieu of the challenges that we face. So as we close, I ask you, what gives you hope?
Well, you do. I will tell a story about Nicole, because Nicole served on the board. I think everyone knows that, and I will never forget, she was helping us find a new executive director, right? Nicole and I and a couple other board members were working to recruit a new executive director, and I will never forget the day. I was traveling for work, I was in a hotel room in a different time zone, and Nicole and I were having another catch-up call about, what do we think about this candidate or that candidate? And she said, you know, I think it's maybe something I would want to do. And I knew you would be the right fit because of what you just described, right? You had done the work, you had talked to people, you understood how this organization worked, you understood its challenges, you understood where it was at the time, which was in a pretty challenging place. And you said, I want to take it on. I'm excited about what we can do and what we can build, and we can make a real impact, not only for survivors, not only to support the mission, but to truly change the culture of the organization and to support our incredible staff every single day. So you give me hope. The staff gives me hope. I see them at events like this. I see them out in the community, and everyone is incredibly enthusiastic and dedicated and passionate about the work that they do in a way that you don't get just from a job that you go to, right? That comes from a deep down just focus and passion about your work and about the mission that you work for, and about your leader, and about who is in the chair helping to guide the organization through the next, I won't say 50 years, the next 50 years. But I am excited about where this organization is headed. I wish this organization wasn't needed, right? But we know that it is. We know that the work is critical every single day. And we know that CRCC is a place that people can turn to and be believed and be listened to, and know that when you come here, you will be wrapped in services and love and support, and you will get what you need to heal and to move forward. And I'm thrilled to have been a part of it for as long as I have been, and I am looking forward to the next 50 years.
I have the privilege of being an individual that is mission-driven and people-driven. And so for me, what gives me hope is the individuals that we all serve. To go through a trauma in your life and to still wake up every single day, to function in that, to fight through that, just to make it to the next day, that's what gives me hope. When I sit across from patients who I've referred to CRCC or who are going through other traumas, and they're like, I made it through yesterday and I'm determined to get through tomorrow, that is what gives me hope. It reminds me every single day why places like CRCC have to exist. There's no ifs, there's no ands, or there and no buts about it. Nonprofits right now have to exist, and we have to function. And it has to happen because the people that we serve depend on us, not just every single day, but every single moment, whether it's a word we've given them, a sentence, a phrase, just to get through that moment till the next. And so when I'm able to work with individuals, patients, clients, when I'm able to see that and see them still functioning and moving and going the next day, that's what gives me hope every day.
So you both give me hope. Your conversations, your emails, our weekly and bi-weekly and tri-weekly touch-ins. But you matter. You matter to the staff, you matter to me, you matter to this agency. Your voice matters in this community. And know that I would not have said yes had you not been here. And I thank you, and I am ready to continue to do the amazing work as a dream team. So thank you.
I went out with my friend. We went to a comedy show. Afterwards, we went to a lounge, and I was invited into a section to sit because it was very crowded. I went over there and I sat down. Then next thing you know, out of the blue, I was attacked. It was very life-changing. And I was in shock. I went and filed a police report. I immediately got an advocate, going through the criminal process, She was there every step of the way when I went from the grand jury, conversation-wise, answering any questions I may have. I was able to get in with counseling right away. And I got through that because of the Rape Crisis Center. I would have never been able to do that. I felt like I was at home, that I was around people that understood me, that I wasn't judged, that the feelings that I was feeling were valid. I look forward to my appointment. It's like it's my own little family. Like, they understand me. Like, I feel like I found my little tribe. I wouldn't have been able to get through it without the Rape Crisis Center. That is a fact. I feel like I'm ready to take on what's next.
So that story is simply an acknowledgement of what it takes to share your story. Crystal's story, like Dána J's, reminds us of the sometimes and the some things that we just cannot afford to forget. This work is not abstract. It's not just a concept. It's not a program on paper. It is people. It's courage. It's survival. And it's healing, sometimes out loud, and sometimes quietly every day. And when we have the opportunity to hear directly from our survivors, our responsibility becomes even more clearer. We don't just witness their strength, we are called to match it. To match it with care that is consistent, with systems that are responsible, with leadership that's present, and with a community that doesn't disappear when the moments pass. And that is exactly why we are here this afternoon. This moment, our very first State of CRCC. Just an update or a presentation. It is an invitation to reflect on who we are, how we've grown, and what it has taken to sustain this work in the recent year. CRCC has been part of this community for more than 50 years. That legacy matters. But what matters just as much is how we have continued to evolve, to respond to changes and the needs, shifting the systems and emerging the crises, all without losing sight of our core values. For more than 5 decades, Cleveland Rape Crisis Center has been a place for survivors so that they can turn to be free of the charge of the confidentiality without judgment. But sometimes when people hear our name, they assume that's all that we do. So let me say it clearly. We operate a 24/7 confidential hotline, a lifeline for survivors, loved ones, and professionals seeking guidance. We provide hospital accompaniment and advocacy, showing up in emergency rooms and police stations, and courtrooms, so survivors who are not or feel alone in the systems can feel intimidating or overwhelming. We're there. We offer trauma-informed, culturally responsible, and responsive individual counseling and group counseling that provides survivors meaningful support on their path toward healing. We provide case management, helping survivors navigate housing instabilities, employment disruption, transportation barriers, and access to resources that stabilize their lives. As Lisa mentioned, we operate a human trafficking drop-in center right here in the heart of Glenville. A low-barrier space rooted in dignity, safety, and trust for survivors of trafficking. We provide community-based prevention education in schools with youth serving adults, and in professional settings, because prevention is how we interrupt the harm before it starts. We train law enforcement, healthcare professionals, and victim service providers, strengthening the broader response system so survivors are met with compassion beyond our four walls. And we advocate in policy conversations, in community partnerships, and in rooms where decisions are made to ensure survivors are centered in how systems really evolve. CRCC is not just a crisis response organization. We are a continuum of care, from the first phone call, to long-term therapy, to medical access, to prevention education, to policy change. We walk along survivors at every stage of their journey. And importantly, this work is not limited to one neighborhood, one city, or not even one system. Cleveland Rape Crisis Center serves 4 counties across Northeast Ohio: Cuyahoga, Lake, Geauga, and Ashtabula. That means the survivors that we support live in urban neighborhoods, suburban communities, and rural towns. They are students, their parents, workers in neighborhoods, and community members whose lives intersect in all of these systems. And today, I want to acknowledge the leaders who partner with us, who represent those communities. So if you're in the room, please stand. All of our partners that do the work every single day, you know who you are, please stand. I don't want to call you out. Thank you, thank you. And for those who have traveled near and far from Lake County, Geauga, and Ashtabula, thank you for being a part of this room and this conversation today. Because what matters here this afternoon is just not about Cleveland. It's about the entire region that we serve together. The conversations we're having about prevention, survivor support, trafficking responses, and mental health are conversations that really matter in Painesville, in Chardon, in Jefferson, and in communities throughout Northeast Ohio. So, as we look ahead, we are committed to deepening our partnerships across all 4 counties with schools, healthcare systems, law enforcement, local governments, and community organizations. Because our survivors deserve the support. No matter where they live, they need our support. And at the strength of our region, we will always depend on how well we work together across county lines to build systems that are compassionate, responsive, and survivor-centered. And as the needs of our communities are shifting, whether through the rise in trafficking, the intersection of mental health crises, or the growing complexities of our systems, we have expanded not because it's convenient, it's because it's necessary. We have evolved without losing our heart, and that heart has always been this: believe survivors the first time. Support survivors at the onset. Advocate for change. That is who we are at CRCC. The last few years have tested this organization across every sector. All organizations have been tested. For CRCC, they have also clarified something that is very essential. The work has not slowed down. In many ways, it is intensified. And through it all, CRCC has continued to respond with intention, compassion, and courage. So before we move into the impact itself, I want to pause for a moment to share a bit of context about the season of leadership from me for CRCC. This past September marked my 1 year as president of this organization. Over the past year, my focus has been crystal clear. Listening deeply, led with transparency, and held positions for CRCC, both immediate, importantly, with long-term sustainability. Together, we completed several foundational efforts that are shaping how we move forward. A comprehensive annual report reflecting the depth and the breadth of our work. A new strategic plan setting direction for the next chapter of CRCC. And a community needs assessment that's grounded in the voices and the realities of the people that we serve. These are not just documents on a shelf. These are tools for accountability, for learning, and shared ownership. Today, you'll have access to all of them through our QR code, which will take you on a dedicated landing page. Whether you're an elected official, and thank you for being here today, a partner, or a community leader, my hope is that you really explore them and learn them of the organization that I serve, proudly serve, and with. Because this work belongs to all of us. I also want to share something personal. I lead this organization not just as the president and CEO, of which I am extremely proud to do, but as a survivor. Not once, but twice. That lived experience has shaped how I approach this role, with urgency, empathy, and a deep sense of responsibility. It drives my commitment to secure sustainable funding, to strengthen systems of care, and to inspire our community to really lean in, because survivors deserve more than just survival. They deserve access, dignity, and long-term healing. That lens informs everything that I do here at CRCC. And that lens is why I want to reflect on our impact today. Sexual violence does not exist in isolation. The survivor who reaches out to CRCC, who has the courage to pick up a phone or to text, are rarely navigating just one challenge at a time. They are carrying layers of experience. Trauma, mental health needs, safety concerns, housing instability, medical barriers, involvement with systems that may not always feel supportive and accessible. When we talk about impact today, it's important to name this context honestly. In Cleveland, suicide deaths increased more than 40% in one single year. That statistic alone tells us something profound about the state of our community. Among the survivors, CRCC serves 40% of reported seriously considering suicide in the past month. That number is sobering, and it demands our attention yesterday. But it also helps explain why the work of CRCC looks the way that it does today. Survivors are not just coming to us with one need nearly defined. They are coming with complex, overlapping realities that require thoughtful, coordinated responses. That is why CRCC's approach has continued to evolve. We are not just responding to incidents of sexual violence. We are responding to a broader public health crisis survivors are living every single day. And we are doing this so in understanding that healing cannot be rushed, it cannot be simplified, nor siloed. It nearly shapes every program decision that we make together. It shapes how we train staff together. It shapes how we partner with other systems and other organizations together. And it shapes how we measure success, not just in numbers, but in trust, consistency, and sustainable care. So when faced with these realities, CRCC has made a deliberate choice. We did not want to treat mental health and suicide prevention as an optional or add-on or specialized referrals. We embedded them into the core of our survivor care. Over the past year, more than 700 survivors received free therapeutic services through CRCC. These services are not limited to short-term support. They represented ongoing relationships, spaces where survivors can process trauma, build coping strategies, and begin to reclaim a sense of safety and within our agency. At the same time, more than 1,000 survivors have been screened for suicide risk through CRCC services. That deserves an aside. That is an all-time milestone for our organization. This is not just a mental health statistic. This is a community alarm. And when nearly half of the people walking through our doors are questioning whether life is worth living, sexual violence is no longer a single issue conversation. It's a public health imperative. These screenings were integrated into care, not as a box to check, but as a vital step in understanding the full scope of what survivors were experiencing. This work requires new training, new protocols, and a deep commitment from staff to engage in difficult but necessary conversations. Most importantly, it requires trust. I'm gonna go off script, Denisha, for half a second. I remember when I first came to CRCC, my first 2 months, I asked to speak with every advocate who walked in the door, whether it was at Mentor, Ashtabula, Clark Fulton, Mentor, the Human Trafficking Center. And it was an invitation. It wasn't a directive. Because I wanted to learn the why. Why do you choose to come here every day? And I will never forget when I was in the office with a therapist. And at the conclusion of our conversation, I said, thank you. And I've been in HR for almost 30 years. Chief People Officer, different organizations. So I could tell her body language changed and her head dropped. And I said, okay, what just happened? And she said, Nicole, I wish that you wouldn't thank me. I said, tell me more. I'm a forever learner. She said, this is a thankless job. I wish we didn't have to be here. I wish sexual assaults didn't happen every day. I wish people could live a beautiful life and not have to worry about what has happened to them. And that stuck. And I asked, what should I have said? And she said, just say that you appreciate it and that you support us. And she said, and you have been here how long? And I said, almost, maybe a month. She says, I have been here 5 years, and this is the first time I had a conversation with the leader of the organization. Culture matters. People matter. And that shifted what I thought was happening. And so I dug in and started doing the work and started having conversations to find out what happened. And again, the next 50 years, or at least while I'm standing here and in this seat, is I'm taking care of the people who are taking care of the people. Trust in our teams were prepared to respond with care, competency, and with compassion. When we talk about impact, it's important to recognize this kind of care takes time, and it takes skill. It takes emotional labor that cannot always be captured by a single statistic. But it's precisely this depth of care that defines CRCC's approach today. We meet survivors where they are, not where it would be easier for systems to engage with them. Another area where CRCC works has deepened significantly is in human trafficking. For many years, trafficking has been spoken about in sometimes rare and hidden or happenstance of somewhere else. The data we see today tells a different story. Through intentional expanded screening, CRCC has now screened more than 1,040 survivors for trafficking, making this the largest number of screenings in our organization's history. 47% of those screened were identified as having experience on being at a high risk for trafficking. That statistic demands our attention. Nearly half, not hidden in another country, not happening somewhere else, right here. It tells us that trafficking is not just an isolated issue. It's deeply connected to sexual violence, economic vulnerability, housing instability, and mental health. And it is present in the same communities we serve in every single day. In response, the CRCC served 306 trafficking survivors in 2025 alone. This support included advocacy, counseling, medical assistance, and connection to a longer term for resources. This work has required us to rethink on how we identify trafficking, how we build trust in our survivors, and how we coordinate care across systems that may not always communicate easily with one another. It has also required partnerships, strong partnerships, intentional ones with organizations that share our commitment to survivor-centered care. We are building together more than just a response. It's a model. one that recognizes trafficking as a part of a broader commune of harm and a continuum of harm, and one that prioritizes dignity, autonomy, and long-term healing. For many survivors, access to care is one of the most significant barriers to healing. Survivors may delay or avoid care because of the cost, lack of insurance, transportation issues, fear. Our past experiences with systems were not always just trauma-informed. CRCC responses to these realities have been intentional and collaborative. The launch of CRCC's free medical suite, developed in partnership with the centers, represent a significant step forward in how survivors can access care. Because you cannot talk about public safety without talking about health care access. You cannot talk about economic stability without talking about trauma recovery. And you cannot talk about prevention without investing in early intervention. In its first year, the clinic provided 33 medical services to 22 trafficking survivors. While those numbers may seem small compared to other data points, their significance cannot be overstated. These services represent survivors receiving care they may not otherwise have access to. They represent trust being built between survivors and providers. And they represent pathways to long-term health and stability through connections to ongoing care. This work underscores a critical truth. Access to health care is not a separate issue from a survivor's advocacy. It is to centralize their healing. By removing the barriers and bringing care closer to where survivors are, CRCC is helping change not just immediate outcomes, but long-time trajectories. Even as the demand for crisis response has grown, CRCC has remained deeply committed to prevention. Because prevention is not optional. It's foundational to public health and community well-being. In its most cost-effective experiences, public safety strategies are available to each and every one of us. And every dollar invested upstream saves on the cost downstream. Over the past year, CRCC reached more than 11,000 individuals across Northeast Ohio through prevention, education, and training efforts. That deserves a hand. More than 4,000 students receiving age-appropriate educational guidance. 1,200 victim service professionals trained to respond more effectively. And 1,300 adults and professionals trained youth-serving adults equipped with tools to recognize and prevent harm. This work is not always visible in the same way crisis response is, but its impact is profound. Prevention work shapes how communities understand consent boundaries and accountability. It equips people to intervene earlier, and it helps create environments where survivors are more likely to be believed and supported. CRCC's prevention efforts reflect a long-term commitment to reducing harm, not just responding to it. All this work across services, systems, and communities is rooted in relationship. In 2025, CRCC documented 15,003 survivor support interactions, serving 1,405 survivors. Those numbers reflect something important. Survivors are not engaging with CRCC once and disappearing. They are returning. They are building relationships. They are trusting our teams with their stories again again, and again. Behind every interaction in staff time, emotional labor, and professional expertise. It is with the realization and the approach that CRCC provides the care that is not just rushed or transactional. It is also what makes this work sustainable, not just for our survivors, but for the organization as a whole. As we look ahead, the question is not whether the need will continue. The question is whether our investment will match our need, and whether leadership in this room is prepared to meet this moment with the same courage survivors showed when they walked through our doors. Their needs are real. The systems are imperfect, and the responsibility is shared. So the next chapter of CRCC will require continued leadership, continued investment, and continued collaboration. It will require us to build on what works, what strengthens our partnerships, and remain responsive to the reality survivors are living each and every day. But it also requires something more. It requires your imagination. Imagination about what survivor-centered care can look like when communities truly commit to it. Imagination about what becomes possible when systems work together instead of in isolation or against one another. An imagination about what our region could really become. When prevention, healing, and justice are treated not as separate goals, but as a shared responsibility. So over the next several years, CRCC is committed to expanding access so more survivors across Northeast Ohio can reach us when they need support. We are committed to strengthening partnerships with hospitals, schools, legal systems, and community-based organizations, because our survivors deserve coordinated systems of care, not just fragmented ones. We are committed to deepening our prevention work so that the next generation grows up with a clearer understanding of consent, respect, and accountability. And when we are committed to building a stronger, more sustainable organization, one can continue to meet the needs of survivors, not just today, but for decades to come. Because the truth is, the work of ending sexual violence is not accomplished in a single program or a single generation. It's built over time, through community, through courage, through the quiet, steady work of people who refuse to accept harm as an excuse or as it to be okay. And that is exactly the kind of community Cleveland has always been. For more than 50 years, Cleveland Rape Crisis Center has been part of that story. A place survivors can turn, a place where healing begins, and a place where people choose every single day to believe survivors and stand right next to them. The next chapter of CRCC will continue that story, but it will also expand. It will challenge us to reach further, partner deeper, and think bigger about what safety, dignity, and healing can really look like in our communities. Because the future we are working toward is not simply one where services exist. It's where survivors are met not only with support, but with a community determined to prevent harm from where it began. And that future is something that we have the power to build together. So, I'll close with this. Yes, there are thousands of hotline calls. Yes, there are thousands of support interactions. But what those numbers represent are stories. Repeated visits, follow-up appointments, moments where someone chooses to come back. And come back means they trust us. Trust that something and someone will do something. Trust that someone is listening. Trust that someone will show up tomorrow. And before we close tonight, I want to turn our attention to something else. We know the numbers, we know the data, we know the scope, but we also know something that's even more important. There are survivors in this room. Many of us know a survivor. Many of us love a survivor. Many of us are survivors. Earlier, we honored Dána J through the video you saw, and we are equally grateful for Crystal for the video that we showed of her. But there are survivors in this room. And I am certain that you have not yet shared your story because you didn't feel safe or you thought about the impact. When I was raped, I didn't tell my family because my family are very close. And I knew if I shared what had happened to me, they were going to do something or try to do something that I didn't want them to do. Because I did not want anything to happen to someone in my family. And that's sometimes what a survivor does. They don't talk about it because they believe the impact is bigger than actually themselves. We have to change that. I never knew that I would be the president and CEO of this organization, being a former survivor of rape. But the God that I serve does amazing things. Yes. So that is not why. Because I questioned it when it happened the first time and the second time. But how can you empower and motivate and encourage people that do the work and not share if it's happened to you? And I know for sure that is why I am here. Not to be a face of rape, but to be a voice of a survivor. The flowers here on our stage represent a lot of things. They represent beauty, and they also represent time. After about a week, they won't look like that. But what impact they make today matters. I hear a lot of young people say, I want to give you your flowers now, while you can still smell them. So again, I'm going off script. There's a lot of people in this room that do a lot of work behind the scenes that do not get their flowers. Denisha, will you please come up? I could not do this without an amazing Denisha, thank you for leading the team and getting us to the finish line in excellence. We can do better than that. The phenomenal State of CRCC Planning Committee, Andrew, Kim, Latanya, Meg, Jasmine, Brad, Alexandra, Heather, Jennifer, Jackie, please stand, wave, Monica, Marcy, our entire CRCC team, please stand, be acknowledged, Arnetta, Jackie. We cannot do this work without them. Please keep clapping. Exceptional executive leadership team. Jessica, Ala, and Paul, will you please stand? Thank you. Thank you, thank you, thank you. Talk about a dream team. Conversations that we've had and continue to have, I cannot share, but most importantly, I could not do this without you. To our amazing board members who are here, please stand. Please, please stand. Thank you. You do the work. Thank you. You can do better from our board, please. Thank you for allowing me to serve in this seat. Thank you for doing the hard work with me on the other side of the table. Your support means a lot. We're not done. I call it all the time Nicole Confetti Ideas. And today was one of them. Because you all needed to know and to hear all the great work that they do every single day. Everyone has a Robin. I don't even call myself Batman, but everybody has a Robin at work. Someone that has your back, finishes your sentences, and supports you, and speaks your name well in rooms where you're not in. And that's Latanya. Yeah. Thank you everyone for showing up. Thank you for your support. Being strategic, being innovative, and holding each other accountable. I'm grateful that everyone is here. Everyone is here. To the board again, thank you for showing up. Thank you for leaning in. Thank you for the laughs. And thank you for the accountability, because it matters. It's really about the survivors. It's the result of people choosing over and over again to believe and to show up. I could not show up as my authentic self if I did not have a tribe and a beautiful family to go home to. You cannot do this work and not have a level set to bring me back down, to remind me not only who I am, but whose I am. And to my husband, to my sister, and to my cousin's sister, and my cousin that had to leave. He's on daddy duty. And all of my family and all of my tribe. I thank you for your support, for having my front, my back, and both sides, and would not allow anything or anyone to harm me in any way. So to every important leader and partner and champion in this room, your presence today really matters. Your voice matters, your influence matters. The work ahead of us will require continued courage. It will require your investment. It will require your advocacy in rooms where decisions are really made. It will require partnerships across the different sectors. So, in all things, what is your ask, Nicole? I'm glad you asked. It will require sustainable funding. It will require people willing to stand beside us publicly and privately. If you believe in this work, stay with us. If you have influence, use it. If you have resources, help us to grow them. If you have networks, open the door. If you have a voice, amplify this mission. Because the belief is not passive. Belief is budget. Belief is partnership. Belief is policy alignment. Belief is showing up when decisions are being made. But resilience alone is not enough. We must build systems that prevent harm, not just respond to it. So I need you to give. Yep, I said it. I need you to give because the resources that we need to provide, they have to continue. And the ways that we used to be able to do them are no longer. So we have fundraisers that are coming up. Support them. If you'd like for us to partner with you and have an event, call us. There is no sky to our limit as long as it's integral. As long as the survivor is the center. It's mission-minded and it's of respect. I tell people all the time, I don't have the privilege to close. And we don't have the privilege to remain silent. So my final words tonight. Everyone knows a survivor. You met one today. Don't allow this work to stop. We need you. Our survivors need you. This work needs you. CRCC needs you. The silence is deafening to a survivor. Commit today to be a part of this movement. Commit today to speak our names in rooms that we're not in. Commit today to say that you appreciate the work that is done here every day. And pray that someone that you know, that someone you love, does not need these services. I wish you well. I wish you peace. And on your ride home today, just whisper it. You don't even have to say it out loud. Just say that you appreciate the work of the Cleveland Rape Crisis Center. I thank you for your time, for your ear, but more importantly, for the support that I know that you're going to give. Thank you.